On World TB Day, the Treatment Action Campaign is calling on government to declare the disease a national health emergency. Deputy President David Mabuza is expected to receive a memorandum from the campaign in Mbombela, Mpumalanga. He'll be joined by Health Minister Dr. Mkize when he delivers an address on TB. Slindelo Masikane is following this story for us. Good morning, Slee. What exactly is expected to be on the agenda today? I know a large part of it is trying to get more funding towards TB services.
Certainly, of course, today we are commemorating World Tuberculosis Day. It is commemorated on the 24th of March every single year, and this began actually back in 1882, we understand, when Dr. Robert Koch announced that he had discovered that the bacterium that caused TB, as well as opening the way for diagnosis as well as treatment for this disease. We know that in South Africa it has had quite devastating health, social as well as economic effects in terms of its effects as well as worldwide. And what we're seeing right now today is, of course, is a program that's going to be taking place here in Mbombela, and we have a demonstration, as you can see behind me, by the Treatment Action Campaign. They are saying that they want government to declare TB as a health emergency, and they want to be done for TB what has actually been done for COVID-19. But I am joined by one of its representatives, Mr. Yawa. Thank you so much for joining us. If you can just give us a sense as to how the impact of TB has had on South Africans.
So thank you for having us. One, according to the 2019 report of the World Health Organization, South Africa is one of the top 20 countries that have a high TB infection. Also, about 58,000 people in 2019 died of TB. Out of that 58,000, 36,000 of them were people living with HIV. According to the TB prevalence survey conducted by South Africa, about 390,000 people have contracted TB, and about 236 of them are people living with HIV. Therefore, it cannot be as business as usual, because TB is killing many people, and more especially people living with HIV are dying of TB. Therefore, we cannot treat it as a dinner party. We need to roll up our sleeves. We need political commitment. We need political leadership. We need to fix the problems that are prevailing at facility level. Instead of wasting money by having these commemorations, we need to put more resources into our clinics. We need to put more resources in ensuring that there is access to effective TB medicines, so that we make sure that the majority of the people do not end up dying of TB, because TB is a treatable disease. So what is worrying us? The reason we are calling for our government and the whole world to declare TB as a public health emergency is because we want to see our government and the world doing to TB what has been done to COVID-19. Meaning there is a political commitment in response to COVID-19. On a daily basis, we see in South Africa Minister Mkize giving updates on number of people who contracted COVID, who have recovered. We want to see the same thing happening on a daily basis on TB. During the lockdown, many people were lost on follow-up, and others have defaulted on TB treatment. We need to work together with the Deputy President, the Minister, and everybody, go to our communities to identify and trace these people, link them back to care so that their lives can be saved. What we want to see happening, we want to see our government injecting more resources to our TB response. We are worried. The Minister of Finance, during the budget speech, he told the country that they are going to take about 53 billion rands from the public health, including about 5.8 billion from HIV and TB conditional grant. The question we're asking, if we take TB serious, how are we going to make these interventions if there are no resources? So that's why today we are saying, let us declare TB a public health emergency. Let us fix the broken healthcare system. Let us make sure that there is access to quality, effective, and affordable TB medicines.
Thank you so much, Mr. Yawa.
Thank you, sis.
I think that's where we can leave it for now. That is Mr. Yawa from the Treatment Action Campaign.